What are the various clinical features of hypercalcemia? In the textbooks, we often see the description that hypercalcemia is a disease of stones, bones, moans, and groans. The stones mean hypercalcemia and its effects on the kidney. Bones stand for the effects of hypercalcemia on the skeleton. Moans means abdominal pain and other GI disturbances that are features of hypercalcemia. Groans means the neuropsychiatric manifestations of hypercalcemia. So, this oft repeated statement, hypercalcemia is a disease of stones, bones, moans, and groans. Let us look at the various manifestations in the subsequent slides. Clinical features of hypercalcemia, the stones. Here, what we mean is the renal effects of hypercalcemia. Nephrolithiasis. It could be deposition of calcium in the kidney, or it could be deposition of calcium stones in the urinary tract. If it is in the urinary tract, it is called nephrolithiasis. If it is in the renal parenchyma, it is called nephrocalcinosis. Because of the hypercalcemia, the responsiveness of the collecting ducts for the vasopressin is reduced, and that causes what is called nephrogenic diabetes insipidus. This we have already seen in our CME on polyuria. And of course, the excess of calcium in the blood and consequent calciuria, consequent loss of water and sodium produces dehydration and features of dehydration and thirst. So, the renal effects are nephrolithiasis, nephrogenic diabetes insipidus, dehydration, and nephrocalcinosis. The clinical features related to the bones are the bone pains of calcium. Hypercalcemia typically produces boring pains in the bones and very severe pains in all the bones associated with arthritis. The patients are crippled, they are unable to walk. In severe hypercalcemia, they may be even bedridden. They will not be able to even go to the toilet, and patient has to be physically carried to the toilet or to walk a few steps or get down from the bed. Such will be the nature and severity of the bone pains and arthritis. And this hypercalcemia could be the result of excessive resorption of the bone due to excessive parathyroid hormone. When there is excess parathyroid hormone, excessive bone resorption results in osteoporosis and osteoporosis related fractures. In hyperparathyroidism, the cortical bone may be thinned out, and this could produce cystic lesions in the bone, which is called osteitis fibrosa cystica, also known as von Reckling-Hossen's disease of the bone. These are the skeletal effects of hypercalcemia. What are the moans? The moans are due to the abdominal symptoms. The moaning or the pains in the abdomen, nausea, vomiting, severe anorexia. Patient says, I am not able to eat anything, and he doesn't feel any appetite. And weight loss because of vomiting and anorexia. Constipation, one of the common causes of constipation, not relieved by laxatives and any amount of treatment for constipation. One has to bear in mind hypercalcemia. Abdominal pains are not localized to any one particular region of the abdomen. Vague and diffuse dull pain all over the abdomen. Hypercalcemia can produce calcium deposits in the pancreas and can produce calcific pancreatitis with secondary diabetes. Of course, peptic ulcer disease is also very common in hypercalcemia. Hypercalcemia itself triggers excessive output of acid through the oxyntic cells in the stomach, and which increases the acid formation and peptic digestive products, and which can cause peptic ulcer disease. These are some of the abdominal moans of hypercalcemia. Coming to the neuropsychological groans, there will be impaired concentration. Patient is not able to do any routine work. He feels tired, he feels depressed, and there is impaired memory, confusion, which may lead to stupor, and in severe hypercalcemia, patient may even become comatose. Lethargy and severe fatigue, very easily is fatigued, not able to do anything. Extreme muscular weakness, not able to even move a glass of water from the table to his mouth. And there could be corneal calcification, and which is called band keratopathy. Calcium deposited in the cornea produces what is called band keratopathy. These are some of the psychological features called the groans. So, the disease of bones, moans, groans and stones, which we have seen in the 4 slides here, and we have some other miscellaneous features which we will see in the next slide. Hypercalcemia has got certain cardiovascular features. Usually hypercalcemia is associated with hypertension, particularly diastolic hypertension, increased risk of coronary artery disease. ECG changes of hypercalcemia include shortened QT interval, prolonged PR interval, widening of the QRS complexes, ST segment elevation, and of course bradycardia. Sometimes the ECG may simulate acute myocardial infarction because of elevated ST segments and the other related changes and arrhythmias. Cardiac arrhythmias are also a feature of hypercalcemia, and hypercalcemia not only produces calcification of the pancreas, calcification of the kidneys, it also produces calcific deposits all over the vasculature. The other features of hypercalcemia include generalized pruritus or itching and keratoconjunctivitis due to irritation of the cornea due to calcium deposits. There could be chemical keratoconjunctivitis. So, these are some of the other features of hypercalcemia.